What symptoms can I expect from an acoustic neuroma?
So the symptoms that appear when a patient has an acoustic neuroma is somewhat variable, and in fact, it's a fairly wide range of possible symptoms. We know there are a number of factors that determine whether or not a patient has symptoms and the type of symptoms, and these factors are as follows. First, the size of the tumor. While acoustic neuromas grow over time, it's thought that their increasing size over time may stretch some of the nerves nearby or may put further pressure on the surrounding brain, and this may lead to more symptoms. It's also thought that the duration at which you have the acoustic neuroma is potentially related to symptoms, and one would expect that a patient who's had acoustic neuroma for 10 years may be more symptomatic than a patient that has had acoustic neuroma for just 1 or 2 years. We also know that there are some factors that vary from patient to patient. It's possible that some patients may have acoustic neuromas that can achieve quite a large size with minimal symptoms, and other patients have a very small acoustic neuroma that can be causing a lot of symptoms. So we typically say size, duration, and some other patient-to-patient variable factors are related to symptoms. Now, what do we know about symptoms? We know that tinnitus, which is the ringing in the ear, and hearing loss are the most common symptoms of acoustic neuromas. It's possible that other symptoms can develop, but those are the two most classic symptoms that we see in a patient who presents with acoustic neuromas. We do know that since these tumors grow very slowly, they can become quite large before causing some symptoms, and that's because the brain can slowly adjust and move out of the way as the tumor enlarges. And this process of moving over and moving out of the way as the tumor enlarges continues until the point where the brain cannot really stretch or move anymore. And at that point, patients typically have an acceleration of their symptoms. So as the tumor pushes on the surrounding structures, the type of symptoms that you develop depend upon the structure that is pushed on. If the tumor pushes on the brainstem, which is a structure that connects the brain and the spinal cord, a patient may develop weakness or numbness in the arms or legs. This is a fairly rare symptom and usually occurs late in the stage of the tumor when the tumor is quite large. If the tumor compresses on the cerebellum, which is the area of the brain that controls balance and coordination, this can cause balance problems when a patient walks. The balance problems may be very subtle, like they have a difficulty walking on uneven surfaces or making quick turns, but otherwise walk normally, or it can maybe more profound balance issues where they're falling when they're walking under normal circumstances. If the tumor pushes on other nerves, you can develop intermittent episodes of vertigo. Vertigo is defined as the room spinning around you. So it's different than lightheadedness or dizziness. It's actual true spinning. Most of the patients that experience vertigo need to lie down for a period of hours to a few days until the episode passes. And then finally, an acoustic neuroma, if it pushes on the trigeminal nerve, which is another nerve located in the back of the head, you can develop actually face pain or face numbness. And this typically occurs in about 5% of patients with acoustic neuromas.